most common and frustrating symptoms of long COVID. In less severe cases, people may experience problems paying attention or difficulty finding the right word. When it's more severe, they may have memory problems, confusion, and difficulty functioning day to day. But there are some techniques that may help to ease brain fog. Fox Medical Team's Beth Galvin is here now to talk about it. Good morning, Beth.
Good morning, Elise. And I think this is something a lot of people are facing coming out of COVID-19. And I think we all experience occasional forgetfulness where we say the wrong word in a conversation or something like that. But many patients that are coming to the long COVID clinic at Absolute Care in Buckhead are struggling to function day to day. And while there is no one-size-fits-all answer, Dr. Joel Rosenstock says there are some things that are helping his patients.
Dr. Joel Rosenstock, a veteran infectious disease physician, has worked with more than 150 long COVID patients at Absolute Care, and he says brain fog is one of their top complaints.
So memory problems, automated things they have trouble with. One of the classical findings is misnaming. So they'll be talking and a word will come out that's not the correct word. They misnamed the word.
There is no quick fix, but Dr. Rosenstock says several things have helped ease brain fog in his patients.
And sleep is an absolute priority. And if you're not sleeping because of fear and anxiety and depression, then you need to see somebody. You don't necessarily have to go to a long COVID clinic. You need to see your primary care doctor or your therapist or somebody who you trust and work on techniques. There's many techniques to get better sleep, and that's critical.
If you're a master multitasker, used to doing several things at once,
you got to stop it. You just have to stop it. You have to slow down, do one thing at a time.
And if you find yourself forgetting appointments, Dr. Rosenstock says, make lists and create reminders for yourself on your smartphone.
Remember to pick up the dry cleaning at 5 o'clock when I get off work, whether it's work or your home life, to take care of those things so that your brain can rest, so that you don't get as anxious. Because, I mean, just think about it. Just the anxiety related to, gee, I'm not thinking as well as it's a vicious cycle.
Dr. Rosenstock also recommends puzzles and games, which he says can be helpful for some patients as a way to exercise their brain.
Just do things that take you out of your comfort zone a little bit. So if you really like crossword puzzles and you used to do them, don't do crossword puzzles because that's your sweet spot. Maybe you should do Sudoku, something that you would not do, because that makes your brain think a little bit outside of its comfort zone.
And Rosenstock says he's seen on social media long COVID patients swearing by supplements like vitamin D or C or magnesium or iron. He says while these supplements are being studied for long COVID, right now there's no science-based evidence that supplements can ease brain fog. Instead, he just recommends that patients overall try to eat a healthy diet to support their body while they're trying to recover from long COVID. The good news, I think, Elise, is most people who are experiencing long COVID that he's seeing are seeing real improvements, especially those who are more severe and are getting treatment. But, you know, it's always kind of a question mark of how this is going to play out.
Good to know, though, that things are working. There's things that you can do if you're in that situation. All right. Thanks, Beth.